When patients become more ill, there's always a decision around should they continue to work, should they take some time off, what should they do? It's not an easy decision. There's never just an exact point that you meet in the road that says this is what I'm going to do now versus, okay, this is where I'm headed towards. It probably takes months. Sometimes it could even take over a year to come to this decision. Obviously, it involves the care team, but sometimes it could be a decision that you have to make because of what you're faced with at work. If you're starting to miss more time at work because you've been more sick or had to become in the hospital more times than frequently, it could be a bad year, but also, are you running out of sick time? Are you exhausting your FMLA coverage? Do you need to think about talking with your social work or the CF legal hotline about possibly thinking about disability? Or do you have the option also with your employment to take like a short-term or a long-term disability option? These are all things that are not an easy answer that need to be talked about with the care team, and your health needs to be obviously evaluated periodically from time to time.
As I look towards the future, it's important to think about where I want to go with my career and how that's going to work with my health. So I do have to be realistic that someday I may have to apply for disability. That's going to be a very hard decision for me or for anyone to make. I think the idea of not being able to do my job is just going to be really difficult to face. So when I do come to that point, I will have to have a good conversation with my doctors and the CF care team to see what are my options. I do know that if I do take disability, I will have a better amount of time to take care of myself.
You know, those of us with CF, there are things that we can and can't do. And I think if you're realistic about what you want to do, and you talk to your family, you talk to your doctors and say, this is what you wanted, this is what I want to do, this is why I want to do it, most of the time you'll find a way to do it. You have to understand what your limitations are, but you can't let those limitations define who you are.
To learn more about this issue, ask your CF Foundation accredited care center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.